Today is July 23rd, 2024, and the webinar that we are presenting for you is about the using artificial intelligence and otoscope to diagnose the condition of the middle ear remotely. We have three amazing speakers, high-profile expert in digital transformation, digital health, telemedicine field. We have Dr. Aaron Maberly, the professor, neurosurgeon, and the chief medical officer of Otologic Technologies. We have Dan Viet, vice president of operations from JEDMED, and also Alex Hardin, chief technology officer at Otologic Technologies. Welcome. Thank you for joining us, and thank you for being here to provide us the fruitful information regarding the AI and telemedicine services. I am Dr. Dina Ziadlu, and I will be pleased to be a moderator for this session. I am the board member, chair committee of working groups, and chair of digital transformation leadership at International Society for Telemedicine and Electronic Health, and also a university professor in different universities in the United States. We have several working active groups in International Society for Telemedicine and Electronic Health, and the Digital Transformation Leadership Group is the group that I am leading this group to disseminate the digital transformation concepts in 4 areas: technological advancement, technological change, organizational development, social change, and global change. I would like to have a brief explanation about our organization, which is founded in 1997 in Basel, Switzerland. We have the contribution of over 114 countries around the world to facilitate the international dissemination of knowledge and experience in digital health, telemedicine, electronic health, and provide access to recognition of the healthcare stakeholders around the world. So we have a pool of experts around the world from different countries, from different organizations, institutions, healthcare providers, policy makers, industry representatives, IT companies, and entrepreneurs, researchers, experts, and educators. And this is a great, well-established organizations that always act beyond the networking by offering the training courses and educational programs in different aspects of digital transformation, digital health, telemedicine, and wheelchair care. We have activities such as publications, white paper, reports, webinars, and we work closely with the accreditation bodies to provide the consultation regarding the accreditation of telemedicine, quality assurance, legal insights, regulation, and compliance. We are the non-state actors in official relations with the World Health Organization as well. As I mentioned earlier, one of the great activities that we have is about the empowering the healthcare stakeholders through the training and educational services that we have. We provide the endorsement of courses and training programs as well. We work closely with the universities and provide the special consultation for instance, for curriculum development in digital health, capacity building, organizational development, global health leadership, innovation, soft and hard, and also transferable skill development in digital transformation, sustainability, and future of healthcare trends. Is we are also active. We have the annual student contents and award as well. Here is another example of the collaboration that we have with the accreditation entities to standardize and accredit the telemedicine programs to check the quality assurance. And this is another great opportunity. If you would like to join to our organization, you can learn more about the activities and use these activities in your companies around the world to increase your recognition in the field of the digital health, telemedicine, and electronic health. So please join me to welcome Dan Viet, Vice President of JEDMED. So Dan, please start your presentation. Thank you.
Thank you, Dina, and thank you to everybody for joining us today. There we go. My name is Dan Wyatt. I'm the Vice President of Operations here at JEDMED. For those that are not familiar, JEDMED is a medical device manufacturer specializing in ear, nose, and throat, ophthalmology, dental products, and telemedicine. We've been supplying medical peripheral devices for the telemedicine community since the early 90s. Here in the United States, and have since grown throughout the world with our devices. All of our devices that we sell are for telemedicine are CE and FDA approved, and so they're listed medical devices like they should be. So that's just a little background on JEDMED. What we're going to do today is talk a little bit about our product, one of our products, which is called the Otoscope, that allows you to image different parts of the body. And then we're going to transition that into how our hardware device is able to provide the information to an artificial intelligence platform that's going to help provide a better quality image from the device, from a video, and then also being able to diagnose from that stitched image at the end. So we'll see a full demonstration of that here in just a few minutes, but I just want to talk a little bit about the hardware so we're familiar with what we're using to get to that point. So as I mentioned, we're talking about the Otoscope. It's a medical device for telemedicine. It uses interchangeable lenses so you can view various parts of the body with one device. You can't see it in this picture, but the opposite side of this Otoscope here actually has a screen on it. So the operator of the device is able to look at that screen rather than looking at, you know, a monitor that's in a different portion of the room. They're able to focus on what's in front of them with the patient and the device there. We do have a couple models available. They're all very easy to use. They all include LED light sources built in, rechargeable battery. There's an SD card built into each one so that you can use it as a store and forward device, but you can also use it as a live streaming device. So the device itself can actually output the live video during a call or consultation, and then that way the operator of the device and the provider on the other end can both be seeing the same image from that device. I did mention we have a couple models available. The one that we're going to be showing you today is the Horus 3, which is kind of the latest and greatest version here in the middle. We do still have the Horus 1 available. It's the original design that's about 12 years old now. It's a more cost-effective version than the Horus 3, but it doesn't have quite the same capabilities. It does use both models use interchangeable lenses, and we have lenses that I'll show you here in just a second for multiple specialties. We have pictures of each. We also have the Horus Series E that you see over here to the right. That is a system that was actually developed for here in the United States for school systems, but it is an even more cost-effective version. It does not use the interchangeable lenses, but it has the ability to view inside the throat and the ears. So from an ENT perspective, you can use that lesser expensive device without the interchangeable lenses. Just by pushing a button, you can switch from viewing the ears to viewing the throat. So I mentioned that there are several lenses on the Horus 1 and 3 that you can use to swap between. The first one is what we call the general viewing lens. So you can see a picture of the lens over here to the left, and then a picture on the right of this is actually the back of my throat. All the pictures that you'll see of the anatomy are of my body that I've taken using the devices during some sort of demo or trade show or something like that. We call this one the general viewing lens because it allows you to view various parts of the body, basically anything from about 1 inch away. So you can use it to view the back of the throat. You can use it for the skin, the eyes. There's a bunch of different applications for this particular lens, which is why we call it the general viewing lens. From there, you can swap that to a dermatology lens. We actually have 2 different dermatology lenses available depending on the model, but this is a picture from the original dermatology lens. So you can see a small freckle on my arm, and then the arm hairs kind of around that. So you can see the level of magnification you can get using that dermatology lens. There is also, as you can see on the picture of the lens here, there is a little switch because it includes polarized light and non-polarized light. We also have a ophthalmology lens or retinal lens. We refer to it as a fundus camera. It is able to take this picture, which is a 40-degree field of view. This is an excellent product, being a handheld, low-cost device to be able to take a picture of the retina, and can be used in applications for diabetic retinopathy screening. We've even done work with other AI companies for our device with this particular lens to provide diabetic retinopathy screening using artificial intelligence. And so that uses non-visible infrared light in order to line up the image, and a 200 millisecond flash in order to take a full color picture. So what that means basically is you don't have to dilate the patient's eyes in order to be able to get this kind of picture. We also have what we call an anterior chamber lens, which is just for viewing the outside of the eye. So you can see this is the full LED, the standard white LED. You can see the outside of the eye very clear. There's also a button, black button on the device that changes that to a cobalt light. So you can view scratches of the cornea using fluorescein drops with that cobalt light. One of the last ones that we have is an endoscope adapter. So we actually designed this where you can attach any traditional rod lens endoscope or flexible scope. So we show a rigid scope on here on the picture, but actually this is a picture from inside my nose. So this was using a sinuscope on our device. This does require an external light source because you're connecting to a traditional rod lens endoscope, but you can attach those traditional scopes as long as they have a standard eyepiece. And then the last lens is actually the otoscope lens. And we saved this for last because this is going to transition us perfectly into the artificial intelligence portion of the presentation. So again, picture of my ear here, very easy to use. The lenses are actually adjusting for the camera is actually adjusting for the lenses that are attached. So it actually is going to adjust your focal length and your brightness in order to get you the best quality image for, in this case, looking in the ear. So that's just kind of a summary of the device itself and its capabilities. And what we're going to do is transition now over to Alex and Dr. Moberly from Otologic Technologies. JEDMED and Otologic Technologies have essentially a working relationship. We don't have any sort of commercial agreement, but we do have a working relationship to kind of co-develop. They're working on their software. We're providing the videos from the device and working to better tightly integrate that. So at this point, I'm going to go ahead and pass it over to the Otologic Technologies team. I'm going to stop sharing my screen so Alex and Dr. Moberly can take over from here.
Thank you, Dan, for your presentation. Please go ahead, Dr. Moberly and Alex. So would love to hear about the backstage of these artificial intelligence and also otoscope.
Yeah, absolutely. I want to start by thanking both JEDMED as well as the Foundation and Society for letting us present today. This is really exciting. So thanks for the opportunity. I was getting over a cold, so I might sip every once in a while just to keep my larynx working. So I am an otologist. So I really focus primarily on ear disease, and that's where this software and technology advancement has really come into play. And we've been working on this about the last 8 to 10 years in terms of developing this system. And so we're really interested in applying otoscopy and artificial intelligence to diagnose conditions of the eardrum and the middle ear, and figuring out ways to actually apply this technology in remote settings and for telemedicine purposes. So again, this is our team from the Otologic technology standpoint. I'm Aaron Moberly. I'm a neurotologist. Also want to mention, as we put our slides all together and compile them, there are some funkiness about the writing, so I apologize for that. But I'm currently at Vanderbilt University and do a lot of work in patients with chronic ear disease. And I'll go into the kind of the medical rationale behind some of the software development that we're talking about. Alex Harden is our Chief Technical Officer, so he'll be presenting a little bit more of the details of the technology and showing that. And then we have a great crew as part of our business in Otologic. So just what I'm going to cover today in our presentation, we'll talk a little bit about what's the problem that we're trying to address and how does Otologic, how are we developing some capabilities that may help solve some of those problems? How does this fit into the clinician workflow? We'll talk about, and then talk a little bit in more detail and showcase some of the technology that we're developing. The big picture here is that we're trying to empower every clinician who has a digital otoscope to have the expertise of an ENT physician in their hands. So the idea here is, can you train up systems that are really trained by neurotologists, otologists, people who have a lot of experience doing otoscopy, and use that to train a system that's able to provide some feedback and output to a clinician who may not have the same degree of otoscopy experience to help them better diagnose ear diseases. That's really the goal. So the problem statement, let me move my little pictures that are in the way here. Otoscopy is a challenging skill. Sorry, let me go back one. All our faces are in the way. So we know that otoscopy is a challenging thing to train. You know, from the one standpoint, any clinician on here, you have this handheld otoscope, you're sort of looking through it, and then maybe your mentor comes in the room and takes a look and they provide some feedback to you about what they see. But it's very hard to train that. And so the digital otoscope itself provides some ways to help in terms of training people to become better at otoscopy. But despite that, in and of itself, otoscopy itself is challenging. This is from a number of reasons. One, the patient might be moving. Maybe it's a squirmy child like this child you see on the left side of the screen. The field of view can be very limited. So you may have obstructions in terms of hair or earwax that's in the way. You may just have an ear canal that's very tortuous, and that makes it very difficult to examine the eardrum in completion. And then again, as I mentioned, limited training. A lot of people come out, if you're talking about potentially, at least in the United States, maybe nurse practitioners or physician assistants, who are sort of the first line of treatment in a lot of situations of acute ear problems. They may not have a whole lot of hands-on experience with doing otoscopy. So all of these things make it very difficult to get a good exam. And what that results in is lots of challenges in terms of making accurate diagnoses of ear disease. We know that there's overdiagnosis and overtreatment of things like acute otitis media. And there's also underdiagnosis and undertreatment of certain types of diseases. For example, a sudden sensory neural hearing loss often goes unidentified because someone thinks that they see fluid. Well, in truth, there actually wasn't necessarily fluid in that case. So that leads into this problem of, while otoscopy is difficult, really performing an appropriate diagnosis is very subjective. So you take a quick look into the exam, you may have a relatively difficult examination of the eardrum, and then you're supposed to make a good diagnosis of that eardrum. And that's both difficult and subjective, and that's a challenge. So that leads to, again, these problems of over and underdiagnosis of ear disease. Another thing that comes into play here is that we really don't have any good ways with standard otoscopy to share data, to share a good ear examination, whether that's for sharing for teaching purposes, but here in the context of what we're talking about today, for telemedicine purposes, where you get a good exam and you share it either synchronously with someone else who has more experience doing ear examinations and diagnosis, or asynchronously, where you save it and you get a kind of a delayed response from someone who can review that case for you. So as it stands with this handheld otoscope that you see in the picture, there's no way to do that. We also can't collect longitudinal data. So you may have a patient come in who has something going on with the ear, and then you follow them up a couple of weeks later. You don't have any way of really tracking how the ear exam is changing over time, unless there's a good system to do that. So having some way of developing a database of historical images and videos for reference, potentially in that patient's chart or in some other sort of data repository, could be very valuable. So these things lead really into the things that Otologic Technology is trying to build. So the first part of this really touches on that last comment of having as an effective and seamless approach to storing the images that come out of a digital otoscope like the JEDMED horoscope. Is there an easy, seamless approach to storing those and then sharing them with remote viewers? And so part of our solution is really trying to make that an effective and efficient process that can be incorporated into a clinical type of scenario where this isn't a buggy system or something that makes it very challenging to actually access those images and share them with other providers or put them into the electronic medical record or that sort of thing. The second thing is, can we develop software that helps give better images? So as I mentioned, oftentimes the view of the eardrum can be partially obstructed. The lighting might be poor. Things that really inhibit getting a good diagnosis. You can't overcome all of that by any means, but there may be some approaches that take into consideration and take advantage of artificial intelligence and machine learning approaches to actually enhance those images so they're providing more diagnostic information to the clinicians. And then finally, the ultimate idea here is that you put a device in the hands of someone who isn't necessarily an expert otoscopist, but it provides output back to the clinician that says, we think that this is the diagnosis, or we want to provide support to the clinician to say, this is probably this diagnosis. Ultimately, it's still up to the clinician to, completely make that diagnosis and make a treatment plan. But if you can have some software that's really trained up effectively by people who are good at otoscopy and really know how to provide a good diagnosis, that can be a powerful tool to help people that may not have that same experience. And that's really where we're headed with this. So this is what we've been working on for a number of years through Otologic Technology. A lot of this has been supported. It's licensed through a university here in the United States of technology we've been developing on the academic side through NIH funding. So this has been going on for quite some time. And really, there's sort of three pieces to the software that we're developing. The first one we call Oto Storage, and it's basically what we talk about. And Alex is going to show this in a little bit more detail, but I want to kind of show the overarching idea. So here, you take a video clip of an ear exam, and you load this into our system. And this is something that can be recalled at a later date. You can use this system to sort of keep track of your own ear images. This can work for videos or still images that are collected from a video otoscope. And in particular, in this case, we've been talking with JEDMED and using the Horoscope. This is something that's basically up and running at this stage, and we're excited to work with people to trial out this system and get data into the system and see how things are working. Where we're heading after that, second part, we call it Otopix, but it's basically taking a video image of an eardrum or the full video clip, and it's piecing together sort of like maybe the panoramic feature on your phone, where it takes the best frames from that video clip and pieces them together into what we call a composite image. Or here we're using something called Otopix. So the idea here is you might have a video clip where you have partial views of the eardrum. Some of those frames are not great. Some of them are really useful from a diagnostic standpoint, but this pieces those together into something, again, that's a single image that could be shared. It could be uploaded to an electronic medical record, but it could be used for telemedicine purposes or simply for tracking the exam over time. And so that's something that we're continuing to build up and is available for piloting at this stage. And then ultimately, where this is heading is building the artificial intelligence diagnostics tool. So we're calling this EarDX, but essentially the idea of you put this video into our system and it spits out this Otopix, this improved image, but also gives you some sense of likelihood of what diagnosis we're dealing with in this case. So where this is headed, if you can see kind of how this fits into the clinician workflow, you have the video clip that you're collecting on your JEDMED scope or another type of scope if you'd like. You upload this seamlessly into this Oto storage application, which is currently web-based. This creates a compiled Otopix still composite image of that video clip of the best frames, and then it provides some output in terms of what the likelihood of the diagnosis is. Again, that's going to give this feedback to the clinician. Ultimately, it is up to the clinician to say how they're interpreting these findings. This isn't meant to replace a clinician, but it's meant to assist the clinician in becoming a better diagnostician. What I want to show at the bottom, this is some previous results in terms of the development of these systems, where we find there's some publications actually showed a lot of limitations in the diagnostic abilities of primary care, pediatrics, and even ENT docs in performing an accurate ear diagnosis. And in some of our early data sets of test data into this system, we're getting accuracy rates about 75%, moving towards something more like 90% as we continue to develop this in terms of diagnostic accuracy. So we're heading in the right direction with this, and we're excited to start working with different groups and continue building this. One thing is, the more you build these data sets and build those diagnostic algorithms, the better the system's going to get. So at this stage, I am going to turn this over to Alex and have him try to demo this for us. I'm going to stop. And Alex, you should be able to take it over.
Okay, yep. Thanks, Aaron. And thank you everyone for being here, and for having this put together and letting us present with you. I hope this is useful for everybody. So yes, I will. I'll walk through just a quick demonstration of this technology. You should be able to see it on my screen right now. We're looking at a list of exams, and what I'm going to do first is, imagine that I'm going to create a new exam for a patient, and I'll show you the video that we're going to use in just a second. And this was actually recorded with, I have one of JEDMED's scopes. This is a Horus 3 in my hands right here. The video I'm about to show you, I actually recorded on myself. It's my own ear, and I'll show you that in a moment. So what we'll do is, to create this new exam, I'll pick a patient. We'll say this is for Bobby Smith. The exam is today. You get the exam started, and I'll show you before I drop the video in.
Is it still on mine, or have you taken it over?
I believe I've taken it over. Everybody who's watching, if you've probably seen this already, but up at the top of your webinar screen in Zoom, you have to click on the Alex Harden screen. That should show you the current presenter. Are you not seeing it, Aaron?
No, I'm still seeing. Are other people seeing him?
No, Alex, do you want me to stop sharing so you can share your screen to show the demo?
Zoom tells me that I'm sharing. Let me try again.
Let me. I can stop the sharing so you can share your profile. That would be better, I think.
You're not seeing anything?
There you go. That looks better.
Yes.
Not sure what the issue was. Yeah.
Yeah, it just all of a sudden popped up and said you can see my screen. So, okay, great. I won't rewind everything here, but we're now looking at me creating an exam in the Oto storage platform. And what I'm going to do is take this video from this Horus scope, and I just put it in the platform, and I'm actually going to open it up in a bigger view so you can see exactly what this looks like. And it might be a little choppy coming over the screen share, but you'll get the idea. So this is just a 7 or 8 second long clip of my ear, and you see there was a little bit of footage of my my ear canal as I was inserting the otoscope in there, and then it finally got to focusing on the eardrum. So that is the video that I just placed into the platform, and we can pan through it on here again or watch it. But the neat thing, getting into what Dr. Moberly was describing, is the OtoPix results. So this is the stitched image. So what this did is this took all of the best, most in focus eardrum looking frames of the video and stitched them together into a composite image, kind of like Aaron said, like a panorama or panoramic photo on your camera. So this is one single image representing the entire eardrum. That's a little bit easier to pass around than an entire clip. And what I'll do now is switch over to the Ear DX tab. And what this has done is run that image that we were just looking at through our diagnostic AI model. I'm getting a note from Zoom that my connection is unstable. Please interrupt if I'm if I'm inaudible or anything. And what you're seeing here is our AI model indicating that that my ear basically is normal. It has a 99% chance of being normal and not having any other issues. We can compare that to a different video. This one is not my ear. And so while that's uploading kind of behind the scenes here, what I would do with the right ear is I would indicate that this is normal. I might have some notes to type up about this. I won't do any of that right now, but there's a little bit of data collection capability here for each of the ears. While this other video here is uploading, we can pan through it a little bit. This one actually is not a normal ear. Some of you may know what's going on here. I'll give you a few seconds to watch this. Maybe you come up with a guess as to what's going on with this ear. And once the stitch is complete, here's our OtoPix image. So this is the single composite image of that entire video clip. Jumping over to EarDX, we've found that this ear is likely, again, it's not a guarantee, but it's likely to be a fusion. I happen to know, based on the video that I used, that this is in fact this was an ear with a fusion, and this is correct in this case. You can see there's a little bit of the AI thought there was a little bit of likelihood of retraction, so that shows up here with a very slight amount and a very, very small amount sclerosis. So if there are ears that maybe look a little normal, or a little like a fusion, or a little bit like multiple different conditions, the model would highlight that if it's able to make that distinction. So that's really all three products in a nutshell. And like Dr. Moberly mentioned, we have the core of this auto storage. So at creating exams and placing the videos from the Otoscope into the platform and being able to share them, I'll generate a quick report out of here. There's not much in here because I didn't type anything or record anything about the conditions, but this is just a quick one-pager PDF report that could be shared with another clinician. If you want to get feedback on just the images, then you don't need to share the entire video. You'll also soon be able to grant access to a reviewer in a telehealth setting to log into the platform and view what you've loaded into here. So that's Auto Storage, and that's available now. OtoPix and EarDX, those are available on a beta and pilot basis. We're looking to collect more data to make if you're familiar with AI and machine learning, to make the models more robust. We need lots of videos to train those models, and we're going through that process right now. So that's the demo of the Otologic platform. Dina, I'll hand it back to you now.
Thank you, Alex. Thank you, Dan and Dr. Moberly. It was very useful, informative, and I really enjoyed. I am pretty sure our attendants also enjoyed the conference, this webinar. I would like to invite the attendants, if they have any questions, they are feel free to share their question in a chat box, either in a chat box or in a Q&A session. So if we don't have any question, I would like to ask some questions. The first question that I have is about the future trend of healthcare, because I am working on the most of the time in future trends in innovation, and I consult the HIT companies how they can build the 21st century design based on the future trend of healthcare. One of the future is about the digital self-care intervention. I would like to know that if you have this idea to deliver these types of the tools to the patients, empower them and engage them in using these kind of tools at home to, for instance, capture their ears, capture their eyes issues, skins, and then transfer this information to the doctors through the electronic health record. Do you have this future in mind? Because in some of the slides, you mentioned that the focus in empowering the clinicians to have a better diagnosis, reduce the medical errors through these traditional devices that they are using. So how we can have these devices for the patients? Do you think it can be a cost-effective tools for the patients in future?
So I'll actually go ahead and take that one. So I guess in theory, yes, but to what we're trying to do is the devices themselves, the actual hardware components do require someone with a little bit of knowledge as to how to operate it properly. The average patient in the world does not have an understanding of the anatomy of the ear or the eye in order to get the best quality image. So what we're trying to do is eliminate barriers to those patients getting the healthcare services they need. So what we can do is put the device in the hands of someone that has a little bit of practice or experience using this device, and then they can, not being an ear, nose, and throat physician, can provide the data to the model so that it can provide a diagnosis from there. In many cases, especially when it comes to specialists, and in this case, ear, nose, and throat specialists, there are not nearly enough of them throughout the world to serve the patient population that they should be serving. I've been recently told about a specific country where a portion of the country was served by one ENT physician, and there were over 1 million patients in that area that he would have to serve if if those patients had something going on. So we're trying to really bring access to better quality care in situations where they didn't have it. So maybe not necessarily in the home, but maybe in a rural community of some kind, there would be one station where everyone in the community could kind of come together and see that the clinician that's there get a diagnosis, get a referral, possibly even be seen by the physician that would be doing a follow-up if there's something that needs to happen quickly. So it's really more about providing access. It could be in the home, but more likely in a small clinical setting than it would be in the house itself.
Okay, you mean it's not going to be used in a large scale hospitals?
It certainly could be, because as Dr. Moberly mentioned, the quality of care, and I'm not sure if those are statistics from the United States or from throughout the world, but as you could see, the quality of care is not nearly what it should be.
Right.
Essentially, if you could put the best ENT physicians, in this case otologists, in the world in everyone's back pocket to where they could access essentially their clinical history, you're going to get better access to care. So I think that's really the biggest thing with that is, you want to provide best quality care access. You could have a physician of some kind, but if they're not an expert on that particular field, they may misdiagnose or underdiagnose, like Dr. Moberly was saying.
Thank you. Let's see what we have in chat box. Yes. We have a question. Is the AI tool available to be used in other countries? One of the attendants is asking this question, and he's mentioning that I feel it will be vital in underdeserved communities, especially from low-income countries that cannot access proper health, so they can get access to these kind of services. Yes, this is the one of the question. I will ask you the rest of questions.
Yeah. Yeah,
Yes.
I can answer that. That looks like
Okay.
Philip, thanks for the question. Yes, with some caveats, and this will actually get into one of the next questions that I see in the list. We need to collect some additional videos. It can be used in a beta mode right now, a pilot mode. But it needs to be trained on additional cases of ear conditions. And Dina, if you don't mind, if I jump right to the next question,
Sure.
it plays into this. The next question from Idris is, what are the potential bias in the data set for the AI models, and have you addressed this? That's a great question, obviously related to AI work. The potential bias at this stage is the quantity of training data or training videos that we have in each for each condition of the ear. So we have trained our model on eight different conditions, and we have varying numbers of cases or videos for each of those conditions. And the ones that have significantly more or significantly less are the ones that will represent the strongest bias in the model. So that, going back to Philip's question, that is what we are working on overcoming right now, and why we're putting the product into a beta mode so that we can work to collect additional data and correct those biases in the model. Other bias.
Yes, go ahead. Go ahead.
One more note. I'm sorry.
Yes, sure.
Other bias that we're aware of and being mindful of is regional and age and racial distribution, basically all demographic distributions of our training data. We have a fair amount of variety. I don't have the numbers in front of me as far as the data that we have now, but that is something that as we make the AI components of our product more robust, we'll have as much demographic distribution as possible to avoid bias related to that.
Thank you so much. Thanks for the picking up this question. We have one more question here from Perzemi. Are you going to license the AI models to clinic, or rather have this solution provided as a service?
Yes. So the current model is a software as a service model. So a simple subscription-based access to use the software online. If there's a specific need for a different licensing agreement or something along those lines, we can of course talk about it, but the standard offering is a software as a service platform.
One more question. Do you have any statistic how many hospitals or clinic are using these devices at this moment?
I'll let Dan answer that one.
So for the devices themselves, the Horoscope device in this case, we've got the device in about right around 9,000 locations worldwide. Now, many of those are umbrella corporation, the healthcare system that's now disseminated these out to rural areas, prison systems, oil rigs, wherever it may be, and they feed back to one set of providers. But yeah, total sites globally is about 9,000.
Thank you so much. And the last question I would like to ask from Dr. Moberly. First of all, thank you so much for being here to this webinar and your outstanding presentation. As a person who have a expertise in ENT field, how do you see the future of the AI-powered medicine in our healthcare ecosystem?
Yeah, I mean, I think, it's a big topic and people are afraid of it to a degree. Part of that fear, I think, within both the public, from a patient standpoint, but also clinician standpoint is how is this working? Some of the our team's emphasis is coming up with ways of doing explainable AI, meaning having some feedback from the system about what is the system using to make these diagnoses. And I think that kind of thing, some transparency and how these things are developed is really important. But the bigger thing is from a clinician standpoint, people are afraid that their jobs are going to be taken away. And, I think we see all of these types of approaches as really trying to optimize appropriate diagnoses and really empowering clinicians to be more accurate and provide better care. And so, as has been spoken several times, there's a paucity of ENTs, there's a paucity of otologists internationally to provide adequate care for people. So if you can train up systems that provide some of that expertise to remote locations or to people who don't necessarily have the same training, that benefits everyone because then you're getting better diagnosis and treatment of ear care and patients who have ear disease internationally. So I see it as a tool. This is not going to replace people. I think it's going to optimize patient care, and that's really what we're shooting for here. And just I do want to comment back on the bias question. It's a great question, and I think this speaks to the need for us to be able to build the system using data from lots and lots of different types of patients, adults, kids, all ethnicities, different types of disease. So, part of our desire to be part of this today is we really like to partner with people to try out this system, but not just try it out, but actually feed into it so we can make it better. Because for this to be able to take off and be something that internationally has some value to clinicians, we need input internationally. So, again, just to throw out, we're really excited to be here today. And if anyone is interested, I know that Alex put his contact information in the chat, but please reach out to us. And Dan, again, thank you for letting us jump in on this too. But I guess I went over, but yeah, thanks so much for letting us be part of this today.
Thank you very much. Thank you for being part of our society. Thank you all participants. Have a great day.
Thank you, everyone.
Thanks, everyone. Bye-bye.
Everybody.